Best practices for performing the ZipE BioLock surgical technique. Surgeon training material. Surgical footprint assessment. Take the time needed to clearly visualize the exact anchor placement site, ensuring that soft tissue does not obstruct exposure of the bone or the tendon footprint. Limited visualization directly compromises alignment, control, and construct stability. Anchor placement. The ZipE system biomechanics depend on a centralized position directly beneath the tendon within its anatomic footprint. Warning: the surgeon must not attempt to replicate conventional anchor placement patterns that are often positioned beyond the tendon edge when using this technology. Placing the anchor outside the tendon footprint prevents the intended standard use of the product. In a single row, horizontal configuration, the anchor should be placed approximately 1 centimeter from the distal tendon edge and centered in the visualization of both buttons. This location is critical to achieve controlled, uniform, biomechanically stable compression of the tendon onto bone. Suture management proper. Suture management through the portals is essential to maintain continuity and efficiency of the surgical technique. Technical reference for supraspinatus tendon repairs. All steps performed with the driver are carried out through the anterolateral incision. All steps requiring the suture passer are performed through the cannula. Because the driver and the suture passer follow different trajectories, the suture must be continuously retrieved through the different access points throughout the technique. Key questions. When should the surgeon retrieve the suture through the anterolateral incision? When use of the driver is required for button delivery, graft insertion, verification of proper tendon seating on bone. When should the surgeon retrieve the suture through the cannula? When the suture passer is required to pass the suture through the tendon. Warnings. Avoid pulling on the suture at every step, as this can shorten the opposite limb, cause loss of symmetry, or even accidentally pull the suture out, compromising construct performance. Before manipulating one end, firmly secure the opposite end, as suture balance is essential to ensure uniform load distribution. Limb control. To facilitate implant placement and system alignment in rotator cuff surgeries, use of a Mayo stand is recommended to allow stable shoulder control during abduction and internal/external rotation. Good limb control optimizes instrumentation orientation and visualization of the footprint. Driver alignment. The ZipE system requires full axial alignment for proper function. Therefore, on drivers where the anchor diameter is smaller than the button diameter, the driver handle, driver shaft, button, and suture must remain centered and aligned with each other throughout insertion. Technical reference. During driver insertion, the surgeon should maintain the driver perpendicular to the repair and aligned parallel to the suture throughout advancement. Warnings. Constant pressure on a misaligned button combined with driver angulation greater than 30 degrees relative to the suture can generate resistance during insertion and may damage or break the suture. If a significant loop forms in the suture, the driver may not advance, with risk of suture damage or breakage. If misalignment or a significant loop occurs, slowly withdraw the driver, lightly tension the suture, and re-advance in synchrony, avoiding loops that could stop advancement. Use of transparent cannulas is recommended to improve visualization of the procedure, especially if the surgeon chooses to use one at the anterolateral incision. This can help detect and correct deviations promptly during the repair. Anchor assembly and disassembly on the driver. Disassembly. If it is necessary to disassemble the anchor from the driver, pull the sutures and remove them from the silicone ring, fully releasing the anchor from the driver. Assembly. Remove the silicone ring from the driver by pulling firmly on its holder. Pass the suture symmetrically through the anchor and verify that both the driver and the anchor are free of any foreign particles that could affect coupling. Assemble the anchor onto the driver tip. Manually slide the silicone ring over the assembly until it seats in its groove, ensuring that both suture limbs remain beneath the ring throughout its travel. Finally, pull both suture ends to confirm the anchor is secure, with the suture parallel to the driver and symmetric on both sides of the anchor. Warning: a suture wrapped in a spiral around the driver can affect anchor coupling during placement. Anchor site preparation. To achieve precise, controlled placement of this technology, Prepare the bone in advance by creating either a guide hole or a pilot hole at the surgeon's discretion and based on bone quality. Use a spinal needle to locate the exact insertion point. Recommended hole: use a 3.2 mm diameter punch to create a pilot hole with a depth similar to the anchor length to facilitate insertion. In low bone density, the surgeon may choose to create only a guide hole instead of a pilot hole. Use a 4.5 mm driver without anchors and place it perpendicular to the bone, applying controlled axial pressure, advancing only to the first laser mark on the driver. This shallower hole is sufficient to facilitate initiation of anchor insertion and reduce the risk of anchor uncoupling from the driver during placement. Warning: use only the 4.5 mm driver to create the guide hole. Use of a larger diameter driver may increase the risk of anchor uncoupling during insertion. Slot alignment. The anchor slots must be properly aligned with button placement on the tendon to ensure optimal load distribution. Warning: orienting the anchor slots differently from the button orientation compromises BioLock system biomechanics and may create undesirable load concentrations in the repair. Most insertion challenges are not related to the implant, but to the surgical technique. Each of these points should be observed during surgery. Correct alignment and proper preparation ensure ZipE system biomechanical performance, as well as construct integrity and strength. Surgeon training material.